I'm Paula Bell. I'm the PGY1 Pharmacy Residency Director here at Henry County, and I'm also one of the clinical pharmacists and cover the critical care unit and the pediatric patients. Well, when I came here 2.5 years ago, Charles and I had the same goals. He was looking for someone to start the residency program, and I felt like that I would be able to help him achieve that goal. And so we just kind of set out, jumped in with both feet to start the program here. And we went through all the accreditation process and have recently had our visit. And our program, our goal here is to prepare a resident to be a clinical pharmacist in a community setting. We realize that there are a lot of teaching hospitals, and that's what most students are used to when they're in pharmacy school. But we like to say that's really not real world. That's not what most hospitals are like. And we believe we offer the training to prepare somebody for what it's really going to be like in your smaller community hospitals.
Looking into coming to Henry County, one of the things that caught my attention was it being a community-owned hospital. I think that's a little bit more care-driven versus profit-driven in a lot of those commercial-run programs. So that was one of the things that I was excited about, and turned out to be true coming here. You see everybody's always planning for the future of patient care, not looking just to cut costs, but really looking to benefit the patient.
Our philosophy here is that you're going to spend 75% of your time in patient care. ASHP says that you only have to spend 66% of your time, but we like to bump that up to more, just because we want to make sure that our students have a really well-rounded, or our residents have a really well-rounded preparation. We require a residency project, a research project. We have discussed whether or not that will turn into a DUE or not, but right now our residents are completing the residency project, and they will have to have a manuscript ready for submission before they receive their certificate. Each resident will be on rotation with every preceptor to give them an opportunity to see a variety of different settings. And then they have other requirements of performing a DUE, being on different longitudinal experiences like management, administration, things like that.
It's been a great opportunity so far just to get a good understanding of the type of service that we always strive to provide here to all of the patients. Also getting a better understanding of the additional training and education that I'll receive as a pharmacist. And it just makes me feel really confident that I'm going to come out the other side of this prepared to tackle really a myriad of different situations that you might face in healthcare.
My favorite rotations would probably be first ER. That's why I came here. I know Paula recruited me, telling me that I could have a big impact on what our ER program does, pharmacy related over there. The first month was really getting to know the program a little bit. It was one of my first rotations too, so it's kind of still getting familiar with everybody here. But I will have a repeat of that rotation in either May or June, and I'll be looking a little bit more at hospital protocols. And so that's part of that whole having a big impact, which was one of the things that drew me to Henry County to begin with. So I'm excited about that. And I also liked our infectious disease, because that's one where you get a little bit more interaction with a lot of the physicians than you do in some of the other departments that I've seen so far. So I really enjoyed making a lot of recommendations, a lot of changes.
A typical day, you get there, you're probably going to have a set of patients that you're going to review. You're going to work them up with your preceptor. You're going to go ahead and implement any relevant changes that you are going to make to their health care. Like I said, depending on rotation you are on, we manage quality, so we do a lot of quality data review and collection and implementing changes that we find there to improve healthcare and improve just fluidity in the service that we provide to our patients.
To me, a student that makes a commitment to do 1 more year of school they really need to be a hard worker, but more importantly to me, they're a self-starter. I'm not a micromanager. I don't want to have to be on top of a resident every day telling them what they should be doing. My philosophy is they get a broad overview of what our expectations are, and they have to want to get better. One of the concepts of being a pharmacist is lifelong learning. It's not just what you learned in school. It doesn't stop there. There's a new drug every day. There's a new black box warning. There's a new indication. There's new disease states and ways to treat those patients every day. And part of being a pharmacist is making sure that you stay on top of that. So I think that it bleeds over into being a resident is continuing to try to get better every single day. And we realize that not every day is going to be your best, but working hard and being that self-starter really goes a long way. The whole concept of pharmaceutical care has changed over the last several decades to where you're seeing pharmacists out on the floor and really being involved with the physicians and other with other disciplines collaborating to help patients get better. And that's where I would love to see our residents. They just go to a community hospital where they're on the floor making a difference and taking care of people.